Hello, sir. I'm James La Rosa and I'll be a nurse for today. For today, sir, I will be assessing or changing your linen in an occupied bed. Is that okay? Okay. Now I will performing hand hygiene to prevent the contamination. Okay. Now may I check your ABL band? Okay. Can you state your name? How about your age? Okay, thank you, sir. Sir, do you feel anything painful on your body right now? Okay, how about dizziness? Okay, thank you. And now I'll providing your privacy. Okay. Now we have the equipments here. The first is the hamper. Next is the linens that arrange in reverse order. First is we have the bath blanket, then bottom sheet. After the bottom sheet, we have the rubber sheet, followed by the draw sheet and top sheet, then blanket. Lastly is the pillowcase. Okay. Okay, I will move along this side. Okay. Now I will lower the railings. Then I will put aside the personal belongings of the patient, like your charger and power bank. Then your call lighting. Okay. Now I will remove your blanket. Okay. I observed that her blanket are now soiled, so I will put this on the laundry bag because this is already contaminated. And note that I will put this away from my body. Okay, now for the bath blanket. I will put this on the top of the patient. Okay. Then I will remove the top sheet under of the bath blanket. And the top sheet are already contaminated, so I will put this on the laundry bag. Okay. Now, ma'am, I will assisting you to the side. Okay. But first, let me raise the side rails to prevent him from falling. Okay. Now, ma'am, as a count of 3, I will move you sideways. 1, 2, 3. Along with your pillow. Make sure that the bath blanket are totally covered the patient, so preventing him to expose his body. Next is our bottom sheet. I will place this now. The beddings of the patient will be moved like this. I will tuck out, considering that we have here the rubber sheet and the draw sheet. We will tack along and roll along to the bottom sheet to the patient, back of the patient. Okay. Are you okay, sir? Okay. Thank you for the response. Now, we will start at the bottom sheet. Sure that it's fit. Okay. Now I will twist this side, the bottom sheet, then roll it, then tuck it under him. Now we tuck in the bottom sheet. Next is the rubber sheet. I will place it in the center of the bed. Then roll it again. Then tuck in at the back of the patient. Make sure there is no wrinkle. Then, next is the draw sheet. Again, I will roll this. Tuck it under him. Then I will tuck it inside along with the bottom sheet. And also you will miter the corner of the bottom sheet. Make a triangle, then put that inside, then again tuck it along the way. Repeat it at the top. Triangle. Tuck it the remaining. Then tuck it up. Now I will use the side railings before I go to the other side. Okay. Now I will move down the side railings And I will move this out. Okay. Then I will move the patient to the another side. Ma'am, sir, of 3, I will move you to the other side of the bed along with your pillow. Okay? 1, 2, 3. Now I will remove the bottom sheet. Then roll it because this is contaminated. Then move away from your body. Then put it on the laundry bag. Now I touch the contaminated side. I will again wash my hands. Now we begin at the bottom sheet. I will tap the top. Then I will miter the corner. Again, make a triangle. Then tap the hanging part. Then hang again. Then tap the hanging part again. Again, at the top of this, tap the hanging part. Then tap again. Next is the rubber sheet. Make sure the rubber sheet are tightly. Okay. Then next is the draw sheet. Make sure that the draw sheet covered the rubber sheet entirely. Then tuck it under. Now the draw sheet and rubber sheet are already okay. We will proceed at the top sheet. Now the top sheet, I will place it at the center of the patient. Okay, ma'am. Sir, I will move you now to the center of the bed. Okay. Is there any painful while moving? There's none? Okay, thank you. I will place it, the top sheet at the top of the patient. In order to remove the bath blanket. Now I'm removing the bath blanket. Now the bath blanket is contaminated already. I will put this on the hang, okay, or the laundry bag. Now since the patient are already in bed, the toe part will be, I will requesting the patient to move his toes up to make a toe separation. Okay, can you move your toes, sir? Okay, thank you. And now I will meter this corner again. Tap the bottom. Then meter it. Again, make a triangular. Then tuck the hanging. Then tuck it. Again. Also this side of the bed. Then tuck it. Okay. Now for the blanket. I'm placing it again at the center of the patient. Then my third, again, the two bottom corner. Triangle. Tuck the hanging part. Then tuck it again. Make sure that the top sheet are on top of the blanket. Then tuck it again on the both sides. Then again in the other side. Triangle. And tuck. And also I will tuck this. Okay. And now for the pillows. I will grasp at the end of the pillow. Then again pull. This pillow is clean. The piece is dirty. So I will put here. Then the terminated is will be thrown at the laundry bag. For the last part is the pillow case. I will grasp the end again, and put my arm inside, and I will reach the two bottom end. Then grab the pillow. Okay, now I'm placing again the personal belongings of the patient, like his charger or bank and his call bell. If he needs any help, you can just push it. Okay, now I'm raising the both side rails. Okay, and position the bed at the lowest. Okay, now perform hand hygiene. Wash my hands. Then Document all of the findings, like the bed chain and the unusual findings at the patient.